And okay.
Welcome, everybody. Good evening. Happy Thursday. We're right on the dot at 6:30 p.m. So we're just going to give it a minute or so because we have more folks joining. So feel free to squish around, get settled in, and we'll get started in just a jiffy. Welcome to everybody who just joined. We're going to get started in just a minute. Still waiting for a few more folks to join. We had quite a few people registered tonight, which is phenomenal.
It's rainy and dreary, and it's a great night to talk healthcare.
Right. We are a couple minutes past, and we do have a pretty packed agenda tonight, so I'm thinking we can go ahead and get started, and then I'll let people in as they're able to join. So to kick us off tonight, welcome everybody to Healthcare for All Minnesota's quarterly meeting, post-session update on this wonderful rainy and dreary day. That's great for a Zoom meeting indoors from the comfort of your own couch. For those who don't know who I am, my name is Bahia Manasra, and I support the operations of Healthcare for All Minnesota, and absolutely love the work under HCAM, and just really happy to be here with you tonight. Before I kick this over to our next speaker, I just want to quickly run through some Zoom presentation norms. So a few things. Please stay muted unless you're speaking. We do have a couple Q&A segments sprinkled throughout tonight. So there will be opportunities for you to unmute yourself and ask questions and make comments. But if you're not speaking, please make sure you're staying muted. The chat feature is enabled, so feel free to put comments and questions in the chat. We'll be monitoring those throughout. And then I just want to invite you to feel free to keep your cameras on if you are comfortable. I think seeing one another really helps to build connections, but again, no pressure, do as you are comfortable. We do have access to the reaction buttons that are just in the center bottom of your screen. You can use those to stay engaged as people are talking throughout the evening. And then I want to emphasize that this quarterly meeting, like all of our quarterly meetings, are being recorded. We typically share these out afterwards, so HCAM members who are not able to attend can watch these recordings so they can stay up to date. And lastly, take care of yourself. We know this is around the dinner hour for many folks. It's after the workday. So take a break as you need to. We're really glad that you're here and are spending your Thursday evening with us. So with that being said, I'll go ahead and pass this over to Ann Jones.
Thank you, Bahia, and welcome everyone to our June 12th, 2025 Healthcare for All Minnesota quarterly meeting. I'm Ann Jones, a retired registered nurse and vice chair of Healthcare for All Minnesota. And I'll echo what Bahia said. In the face of all that is happening right now in this country, thank you for signing in this evening and being willing to spend some time on this particular issue of health justice. Our speakers for this evening, and then our agenda this evening includes We'll start off with remarks by our chair, Rose Roach, and then a review of the 2025 legislative session related to healthcare and health policy legislation and decisions. There will be a little bit of time for Q&A after that, because it is a kind of a lot of information in a short amount of time. So a few minutes there, then we'll go on to information on the work of our Legislative and Policy Committee by Don Pilkinen and Dave Garibaldi to help activists be more effective grassroots advocates for a universal single-payer healthcare system, followed by an opportunity to share your ideas on building political will for reform, and then announcements, and that will be with everybody participating. Then I have quite a few announcements and ways to get involved coming up in the next few days and weeks. And we'll finish up with our work to raise the funds we need to continue the work of Healthcare for All Minnesota. So let's start with remarks by Rose Roach, Chair of Healthcare for All Minnesota and the National Coordinator for the Labor Campaign for Single Payer.
Thank you, Anne, and thank you. Good evening to everybody here, sending greetings of health and solidarity. There certainly is no shortage of chaos and frustration these days, but all the more reason for our work to remain focused, strategic, and hopeful. Since our last quarterly meeting, Healthcare for All Minnesota has been a co-sponsor of the Health Justice Rally on April 2nd, the April 5th Strength and Solidarity Rally, the International Workers' Day Rally, and will be a co-sponsor of this Saturday's No Kings Rally. We will actually have a table in the Capitol Rotunda. Stop by and see us. We continue to provide presentations to organizations such as the League of Women Voters, United Auto Workers Retirees, Veterans for Peace, and SEIU Local 284 retirees on the corporatization of healthcare and our state campaign to win the Minnesota Health Plan. Healthcare for All Minnesota is also involved in 2 Medicaid defense coalitions while working hard to connect the dots to how Minnesota could actually save money within Medicaid and Minnesota Care by simply moving the private managed care organizations, also known as the insurance companies, out of our public health programs, saving us hundreds of millions of dollars in administrative waste alone that can help counter the potential devastation of the proposed cuts to Medicaid from the federal government. People are going to die. That is the bottom line. On the national level, hope lies with the reintroduction in the House and Senate of the Medicare for All Act of 2025. Healthcare for All Minnesota remains active in the fight against the privatization of Medicare through these corporate advantage plans and is the lead organization in Minnesota helping to educate the public on the destruction that these corporate overlords are perpetrating on our public Medicare program and the funds within it. Tonight, you're going to hear a recap of a rather frustrating 2025 legislative session when it comes to healthcare reform. The loss of Minnesota Care access for adult immigrants, regardless of immigration status, is heartbreaking on a humanitarian basis, but it also fails to protect public health and is economically nonsensical. Healthcare for All Minnesota fully supported the expansion of Minnesota Care for our immigrant families, neighbors, and coworkers because it was a step towards our goal of everybody in, nobody out, no exceptions. This shows how much work we have yet to do as we strive for a system that doesn't set up arbitrary categories to determine who lives and who dies based on age, socioeconomic class, geography, and immigration status. There is only one race, the human race, when it comes to healthcare, and we must never, ever lose sight of that. We'll also be introducing tonight an exciting new program focused on building relationship and strategy with legislators. If we learned nothing else from the 2025 session, it's that we must have a strong, purposeful, and strategic inside-outside plan for the 2026 session when the direct provider payment plan options will be presented to the legislature and the cost study for the Minnesota Health Plan will be rolled out. Offensively, nothing will be more as important for us as getting the patient-centered care bill across the finish line in 2026. That's the bill that moves the insurers out of our public health programs and provides direct payments to providers along with additional funding for care coordination that comes from savings that are realized by removing those insurers, thereby generating much less in administrative costs that can then be used for direct care. And mark your calendars now. March 10th of 2026 will be our lobby day for next year's legislative session, and we need to show a strong presence at the Capitol as we push to begin the process of building our public health infrastructure while creating the conditions necessary to pass the Minnesota Health Plan in 2028. As always, on behalf of the Healthcare for All Minnesota Board and our amazing Director of Operations, we thank you for your continued support of the organization and its work, and we look forward to continuing our work together in building a multiracial, multi-generational, statewide campaign to guarantee healthcare for all, no exceptions, as our reality. Let's have Minnesota lead the way. Si se puede. Thank you.
Thanks, Rose. So we had a great Healthcare for All Minnesota Physicians for a National Health Program Minnesota Lobby Day in March. And then what happened? Rose is going to give us the lowdown with a review and update of the 2025 session. So I'm going to take my slides down and let
Thank you.
Rose go ahead and
Awesome. Thank you.
let's see. I think if I exit, that'll work. Stop sharing. Okay. Okay.
Oh, in a second. Yeah, it's telling me someone else was sharing, so I apologize for that. Let me get this up and running here. Give me just one moment. There we go. Does that work, everybody?
Yep.
All right. So as I said, rather frustrating session this year in 2025. Lots of reasons for that. But let's just take a real basic look here at what happened. So there doesn't appear to be any real plan or strategy, quite frankly, around healthcare reform when it comes to inside the legislature. That certainly played out this session with competing bills on important steps forward as well as outright steps backwards that had happened. So a couple of the things that we were working on very specifically, and I forgot to put on here the medical debt bill, relief bill, which went nowhere this session because I really wanted to focus on a couple of these that sort of were of massive frustration. At least that one, we knew we were going to have some trouble with it because of the budget situation, and that was asking for some funding. So we weren't as surprised, but some of this other stuff just kind of knocked us off our socks, that's for sure. So I've mentioned now a couple of times the Immigrant Inclusion in Minnesota Care, which passed in 2023, became effective January 1 of 2025, and has now been repealed for any immigrants without documentation over the age of 18. That will become effective in January 1 of 2026. So those who have signed up will continue to be on the plan for this year. This is really very frustrating. It's not even hitting the target numbers that were projected, even though more people signed up than they thought. But because I'm telling you, it's the immigrant community, I think, is overwhelmingly young and healthy. And so even though they have the protection now, it's not like they're just running to the doctor for the heck of it, right? They use it when they need it, and they don't need it as much as was anticipating. So actually, the amount of money that was set aside, it hasn't come anywhere near that amount of money being spent. And of course, this is penny wise, pound foolishness, because we know that people will, of course, go to an emergency room, as they should, to get the care they need when they're in an urgent situation. And emergency room care costs far more money, to say nothing of the public health implications for doing this. So this is not okay. And we are devastated at Healthcare for All Minnesota that this actually ended up being part of the deal. What we heard in the background was there was not a single solitary thing that the Republicans in the House and Senate wanted more than to repeal healthcare for undocumented folks here in Minnesota. The Patient Center Care Bill, this is a major bill, right, in our stepping stone pathway to building public health infrastructure for the Minnesota Health Plan. It only received an informational hearing this year in the Senate. It was a good hearing. It lasted an hour. Some very good questions were asked. Unfortunately, we did not get a hearing on the bill, even an informational one in the House, but it was hopeful to at least get that done in the Senate. And it was all about educating folks. So when it comes time to actually move this bill next year, after we get the report from, or excuse me, the plan options on how to deprivatize Medicaid and Minnesota Care from the Department of Human Services in January of 2025 or 26, we will be able to use this bill, and we should just be able to push it through and get it done. Because there is no question that there is gobs and gobs of money in that program that we are paying to those insurance companies that is not going to people's health care. And if we are going to see these devastating cuts coming down from the feds on Medicaid, we need to find that funding somewhere. And it is a perfect message, makes perfect sense. It's fiscally sound to do that. It's a wash. It's not additional money. It's already money being spent. Let's just spend it on people's health care. So we're really hoping that we can make a big push for that in 2026. The pharmacy carve-out, you may recall that back in 2023, Representative Liebling had put a bill forward to kind of make really the state, the pharmacy benefit manager for the state-run Medicaid and Minnesota Care programs, and just get those PBMs, those in-between folks that are also ripping us off, get them out of our public health programs, and just have the state oversee the pharmacy benefit piece of those public health programs. That didn't go anywhere in 2023. She reintroduced it in 2025, and we were supportive of her bill. And the way she had it set up was so that the state would actually contract with a single pharmacy benefit administrator, but the state would completely control the program. This is somebody that just really helps kind of oversee the program, doesn't have any decision-making authority. That would all be on the state, and it would just be the state, this pharmacy administrator, and then provider patient. That's it, right? That's the flow. But a competing bill came up, and it was supported by the independent pharmacists. And they see this as a very strong step forward, and it is hard to argue with them that it isn't. It includes an additional kind of step in that it keeps the managed care organizations in the mix, but they have to use the state pharmacy benefit administrator. There's only a single one, and it's my understanding that this will make a huge difference for particularly independent pharmacists. It will save pharmacies. It will increase their reimbursement rates for prescriptions that they fill, and it is a very, very important step forward. And a number of other states have done this and have seen it be a very positive change, and a change in which, again, they have saved some money and been able to utilize that money to actually use it for provider reimbursement, and in this case, the pharmacist being the provider. So we did not oppose that bill in any way, shape, or form, and that is my understanding. Is it was passed in the omnibus bill and should now be law. So that's good. You all remember, if you joined us on Lobby Day, that we were kind of hit at the last minute, right before we were getting ready to head up to the Hill, with the fact that a program that back in 2021 was established related to dental care inside of Minnesota Care and Medicaid. And the idea was that the managed care organizations that were handling the dental piece were not actually doing all that well in making sure that patients could get dental care. And so with a bipartisan support between Michelle Benson in the Senate, because the Republicans held the Senate back in 21, and with Tina Liebling in the House, because the Democrats had the House, and of course Walz was the governor at that time, they came up with a compromise agreement that said, let's give the managed care organizations 4 more years till the end of 2025 to see if they can get their act together and do better. And if they can't, and we'll even give them some additional resources to help them. But if they can't start to really help patients get access to dental care, then we're going to have the state just take it over. And this was all set up to happen on January 1 of 2026. They were not meeting the criteria, they being the managed care organizations. So it looked like everything was a goal for that program to come back to the state. It was going to be a sliver inside of the public health programs that we were excited about having the state take back because it could show that the state can do it, right? That the state can actually do it and do it better. And so we were excited about that opportunity. But as it turns out, there was a bill put forward to keep the managed care organizations in the dental program and extend it for another 4 years and not let it just, or let them exit on December 31st of this year, give them another 4 years and to establish a task force that would include managed care organizations and dental providers. We have a dental advisory board, by the way. I'm not sure why we needed a task force, but that they would then present some recommendations to the legislature on how to make the program better. Well, as it turned out, in the end game, what ended up happening was it was a 2-year carve out, not a 4-year. So they've got 2 more years to show that they can do it. And then they still have this task force, which is a little bit concerning because, you know, once the industry's in the room, they have a tendency to kind of suck up all the air and be able to get folks focused on what they want. They're very good at that. So this was unfortunate because we saw an opportunity here that felt like it kind of just got stolen away from us. We did know that there were some holes in the 2021 bill, particularly around what would dentists be reimbursed, because that's a major issue inside of Medicaid in particular. But Representative Liebling again put forward a bill to close that loophole, but it just didn't get traction, and it ended up with this 2-year instead of 4 years to give them an extension. And then for those of you who have been following along with us on the fight for Medicare and trying to get people to be able to afford traditional Medicare with a Medigap or a Medicare supplemental plan, as opposed to going into Medicare Advantage plans, you know that in this country, most states, all but I think 4 or 5, allow insurance companies to underwrite people, meaning they can take into consideration pre-existing conditions. If you first go on to Medicare and choose a Medicare Advantage plan, and then it's not working for you a number of years later for whatever reason, and you want to switch at open enrollment to traditional Medicare with one of these supplemental plans, the supplemental plan has the right to look at all of your medical data and history and decide either to say, we're not going to offer you a plan at all, we'll offer you a plan, but it's not going to cover your cancer or whatever it is that they see as a too costly pre-existing condition, or we'll cover you with that, but now your premium's going to be $800 a month instead of $200 a month. And so we were excited about the fact that back in, again, 2023, a bill was passed that as of January 1, 2026, Minnesota would join 4 other states, I believe it is, who have what's called guaranteed issue, meaning they can't do that underwriting stuff and take pre-existing conditions into account, and they just have to issue you a plan. And that would very much help, sort of, as we talk about it, level the playing field between Medicare Advantage and people who really want to go to traditional Medicare with a gap or a supplemental plan. Now, I'm not going to kid you. The industry, of course, would raise rates in the supplemental plans. There's no question about that, because now they would have to actually have to take people, and people that are maybe going to have to use the product because they're getting older and therefore probably using more health care. We knew that, but we still wanted the people on Medicare to have an option. They should be able to make that choice based on their finances, not just based on this arbitrary nonsense of an insurance company saying, we're not going to, pay for you because you have cancer or you have a, bad heart or whatever it might be. So we were excited because that was going to happen on January 1 of 2026. Nothing had to happen in the legislature in 2025, but something did. In the House, there was a bill put forward to actually repeal that entirely so that they could continue to take pre-existing conditions into account. And in the Senate, there was a counter bill that didn't repeal it, but basically said if you are going to switch from a Advantage plan to traditional Medicare and a supplement, you're going to have to pay a lifetime penalty in order to do that. And so, of course, when a bill is different in the House than it is in the Senate, that stuff gets all hashed out in what's called a conference committee. And the conference committee came up with this convoluted mess that I've been saying this all along. I quite frankly wish they would have just repealed it so we could have started from scratch. You can see on the screen that that they actually came up with a deal where it's this penalty for switching between age 65 and 70, and it escalates over that time period. And but it is at least guaranteed issue. But at age 70, there's no longer guaranteed issue, and there's still a penalty for making the switch. So this is very industry friendly, needless to say. I would even venture to say that I think we've got some age discrimination going on here. And as you all know, I also work on the national level, and I raised this issue yesterday with the Reclaim Medicare Coalescence at a national level, and was able to chat with a leader in the Center for Medicare Advocacy out of the East Coast, and he and I are getting together with a couple of Medigap experts from across the country. They're very interested in this because they too think that this is very problematic, as does AARP, who we actually worked pretty closely with in this legislative session because they did not support the repeal of the Medigap guaranteed issue. So, strange bedfellows a little bit because AARP doesn't necessarily support single payer, but they sure did support us on this. So we work with whoever we can work with to move program when it's in a positive direction, right? So what a mixed bag this was. It just goes to show you how much work we have to do, how much education we have to do of our seated legislators, as well as, of course, the general public. So folks can really push and let them know this kind of stuff isn't helpful. And if you mean it, if you are a co-author of the Minnesota Health Plan, if you stand up in front of audiences and you tell them you support single payer, you can't be working on stuff that either takes us backwards or doesn't at least make a move a step towards where we're trying to go. I'm really frustrated. I feel like I just want to say, are you with us or aren't you? Because if you're not, then it's a different kind of a strategy that we on the outside have to run. But if you are, then you have to mean it. And we need to make sure that we're talking to each other and that this kind of stuff gets vetted at the legislature to make sure that it is something that is moving us in the right direction. So that is kind of the legislative session and healthcare reform update. So I think I can probably take the slide down and do questions, if anybody has any. I hope I explained it fairly well. Yeah, Ken, go ahead.
Yeah, Rose, I was just wondering if you knew the rationale on the guaranteed issue for increasing the percentage penalty over time such that it's 35% by the year 2030. I mean, is there any reasoning or rationale behind that?
If there is, I don't know what it is. It was just doing what the industry wanted, which is who screams and yells, "Oh my God. I mean, we're going to have to like take people who are sick and it's going to just completely screw up the market. And we can't have people doing this. So let's penalize them for wanting to do it." And so no, I don't, if they're, like I said, we haven't been able to talk to anybody yet to find out exactly an answer to that question. It's a great question. I'll see what we can do to find out. I'll make sure everybody knows what the answer is. But as of right now, I am not able to tell you why they did what they did. And of course, we were asking our members, and I know lots of you participated in getting phone calls in and email messages and stuff. And there were a lot of other organizations doing the same. Minnesota AFL-CIO, also retirees, as well as I said, AARP and a few others. But you know, they were behind closed doors on sorting out the final budget deals and those final omnibus bills. So who knows how the hell they came up with that convoluted mess? It's embarrassing.
Okay, thanks, Rose.
Yeah, sorry, I don't have a better answer for you.
This is Steve. I don't know if you saw this email that came from my legislator, Dave Pinto, about the reinsurance. Any comments on that?
Yeah, so I haven't seen it, to be honest with you, the final deal, but I appreciate you, Steve, sending that because that was the first time I'd heard where they finally landed. It sounds like we're putting some public dollars in, but I haven't heard a hard number. But mostly we're having the insurance companies reinsure themselves, set aside fees that will go into dedicated accounts where they can actually go in if they get a big, claim and they feel that they need more funding, they can go into that account and they can get the money back out again. That's where a lot of states do in regards to reinsurance, and it's sure as heck a heck of a lot better than the state writing another half a or 3/4 of $1 billion check to go into the black hole of insurance companies. So I think there's limited public dollars. I don't have a hard number on that, though. I haven't seen anything come across that has told us the hard number on reinsurance. So let me see if I can do some digging and find out what that is. But it sounded like there was still a little bit of public dollars going into this, but at least they also moved in the direction of having them reinsure each other. Because God knows they've got enough money to do that.
Thank you.
Yeah, you bet. Yes, Dave.
I just wanted to let folks know that we did send out letters to both of the Senate and the House health committees over this reinsurance, or not reinsurance, over the guaranteed issue deal. And I did get one back from the author of the bill in the House, Steve Elkins, that he told me that you were probably not aware that premiums, if we don't do this, could go up 15%. So now in hindsight, I didn't like that at all at the time. I thought it was stupid. That why wouldn't you just say to the companies, well, buy now. If you want to raise premiums, could buy it. You don't have to bid. But they never do that. But now here we are with 35% increase. So how is that better? Not the greatest at math, but it seemed like the 15 would have kept things lower. So there we are.
So you all should also know when the bill was passed to do this guaranteed issue, part of it included Commerce, the Department of Commerce, doing actually a comprehensive study and report on what would be the market impact of guaranteed issue. And what I have that report. I have not read it all entirely, but I know what Rep. Liebling said to me is I think they came out and said that there would likely be an increase in premium costs of about 16%, but that was over like 4 years or something like that. So, it's not great. It doesn't need to go up at all, quite frankly. But nonetheless, an additional 4% just because of market trend on the cost of that would be potentially affordable for some seniors and Medicare enrollees who were looking at what would be a better way for me to go, because with anything you're dealing with insurance in this darn industry, it's all about what is your upfront cost versus what are you willing to pay on the back end, because you're going to pay one way or another. If you pay a little more on the front end, you hopefully won't get that large deductible bill or copay bill or whatever it is on the back end. That's what you're protecting yourself against, right? And so the idea would be if somebody said, gee, this Medicare Advantage just isn't working for me and I'm getting claims denials and things, and the deductibles are too high for me, I'd rather figure out how to pay an additional $75 a month for a Medigap plan, in addition to what the cost is, they run a couple of $100, maybe 250. Add that, I'll figure that out in my budget because that would be better for me. Because I'm telling you, you guys, I have traditional Medicare and a Gap plan. I don't have, I'm getting hip surgery a week from next Monday. I went in for my Medicare wellness appointment on May 9th, complained about my hip hurting me. On May 12th, I was at the ortho. On May 22nd, I had an MRI. On May 23rd, I was told to call the day after, that was Memorial Day weekend, the day after the Memorial Day weekend to get a surgical consult scheduled. I was in the office the day after that, which was the Wednesday of Memorial Day week, and I'm scheduled for surgery on the 23rd, and he wanted me in on the 10th, but I need to get a kid back here to help me for a little while from California, so I couldn't make it happen that week. Do you know why I didn't have to go through any hoops? Because I have traditional Medicare with a Gap plan. So, you know, say what you will about all of that, but man, it makes a big difference for people. And they may very well want to be willing to pay that a little extra for that kind of peace of mind. No networks. I don't have to deal with any of that stuff in traditional Medicare. Now, I know here in Minnesota, we have a pretty decent Medicare Advantage plan through UCare, and we are lucky. We are absolutely the exception in this state because we have that, because I got to tell you, in most states, United Health is the #1 Medicare Advantage plan, and they are awful in the way that they treat their patient population. Absolutely awful. Yeah, Anne, go ahead.
Oh, so 3 things. I'm sorry I confused people. The 2025 Lobby Day thing was just by way of introducing Rose for this last session. We've already scheduled our 2026 Lobby Day, and it happens to be the same day, only it's a Tuesday. Okay, so hope that's clear. What Rose is talking about with this guaranteed issue problem is that it just points out how much educating we need to do about the economics of healthcare, the amount of money that is being sucked up by the industry, and just let's remind ourselves that we don't really contribute that much to Medicare when we're working. 1.45% FICA tax with a matching by employees, that's really low. So let's just think about the fact that we're really not putting enough money in, which is partly, and then we're being defrauded by, you know, to the tune of billions. And all of that seems to be missing in the conversation. So we got lots of work to do on educating. Third thing is Hildy Hessian is in our meeting this evening, and wondered if you would like to comment on the pharmacy, what's the name of the bill?
Yeah, the pharmacy carve out or whatever.
Yes, and the bill that actually passed, her dad and Hildy
Sure. Yeah,
own St. Paul Corner Drug.
sure. Yeah, I'm sorry. I was trying to get my video on, but I'm on a new work computer, so
Oh, no. Okay.
so I'm just gonna talk. My hair is messy anyway. So yeah, my dad and I we're part of the legislative working group, we call it, for MINDES, or Minnesota Independent Pharmacists. And we too love the idea of a carve out, wish we could get that done. Per a lot of input we have from several different areas of this work, that's going to be a really hard hill to climb here in Minnesota specifically because of how entrenched 340B money is. And that's a really complicated program. I don't even understand it. I won't get into it, but that is why our working group decided to, with our lobbyists, really push for the single PBM model, which has been successfully passed in several states now. Ohio is a great example. I'll see if I can find a link or a couple of the reports of the savings that their state has seen. But people's main worry about it is that they don't understand it, and they think that what will happen with the bill is that the state will become a pharmacy benefit manager. That is not happening. What is happening is we're transitioning for the 85-ish% of people who are on Medicaid through a PMAP, right? Or like a private insurance company through the MCOs, like Health Partners, Blue Cross Blue Shield, et cetera. Those 85% of patients now, their drug benefit will have to be managed by a single PBM that the state contracts with and sets the reimbursement rate for, which is part of what's built into the bill. And it's actually a reimbursement rate that covers our cost of doing business, which is not usually what we're paid for filling prescriptions these days. We're usually paid below cost, which is why pharmacies like us are closing. So even though it's not the cleanest route that we wish we could have gone, we felt it was most possible. And we had a lot of support, bipartisan, partly because so many red states in particular have passed this and seen success in recent years. So we're feeling really positive about it. It feels like a really big win. It absolutely is a starting point. Like, we have so many more steps to go, and we would love for PBMs to just not be a thing at all. But that's, we can't do that tomorrow. We have to be patient and chip away at this problem. So that was the big one. Another, and then our other pharmacy provision that passed that I'll mention is the directed dispensing payment program, which is essentially just an establishment of a Band-Aid solution where pharmacies like us, those who qualify, there are criteria, right? Those in urban areas or serving underserved communities, we will get an extra $4.50. And by extra, it really isn't extra, because the dispensing fee we're collecting on those prescriptions for Medicaid folks, we usually get a $0 dispensing fee, maybe 25 cents, maybe 75 cents, which is supposed to cover the actual $14 to $17 cost of us filling a prescription. So it's really not extra, and it's certainly not technically completely making us whole, but it's better than nothing. And last year, when we proposed it first and it didn't make it through, it was cut down to like 75 cents or $1. So we're really excited that the $4.50 we suggested actually like stuck it out and stayed with it through the end. So that is just a Band-Aid solution, and it will only be in place until the single PBM comes into effect 1/1 of 27. So it's unfortunate, because it is the state paying more money to recoup, to make us whole, because the ones that they've hired to pay us aren't paying us. Like, it really is an unfortunate situation, and we wish that it didn't have to happen. But we're gonna lose even more pharmacies if we don't find a way to just keep us afloat. So that was kind of the other big one that passed for us, and we have a lot of priorities for next year. So yeah, I guess if anybody is interested in talking more about pharmacy, I won't take more time, but please feel free. I put my email in the chat. My dad and I, other than a couple other entities, are kind of are really closely intertwined with what's happening with pharmacy in Minnesota and stuff. So more than happy to answer questions, have conversations. Is that what you were looking for?
That's great, Hildy. No, that you did a much better job than I did, because you were working the bill yourself, and we appreciate
it's
your work.
it's a very, very confusing issue. Like, we even had Fox 9, I think, did a story a couple days ago and came to interview my dad, and it's just like what they published was really just like not what it is. So PBMs are confusing. They are meant to be confusing. So we're a great resource. Minnesota Independent Pharmacists, or Mindy's, I'll put our URL in the chat too. They're a great I mean, I guess I'm part of that, we too, but we're a great resource as well if you have if you're encountering not understanding pharmacy stuff, which is totally fair, because it's really complicated. Yeah, but I won't take any more of your time unless people have questions.
No, that's fine. That's great. Thank you for your work on that. And we're glad to have you here with us in this fight all the way through. So thanks for that too. And great. I just pulled up quickly what you put in the chat there in regards to comparing traditional Medicare with a supplemental plan versus Medicare Advantage. Thank you very much for doing that and supporting the work we're trying to do to get rid of the privatizers out of Medicare as well as Medicaid. So
yeah, we made that in conjunction with you guys, I think sometime last year. So like I said, we have it printed really big, like 3x4 in our pharmacy, and just have it up there. John vaccinates my dad at the front of the store all day long and talks to people all day long about trying to get back on traditional Medicare where they can, or just being aware of the fact that they're on a Med Advantage plan and what that means. People don't know, patients don't know what's going on. So yeah, if you want to print it yourself, whether that's like on paper or on like a permanent foam board type thing, hit me up.
We
All right.
have
Get you to
it,
the
Hildy.
design.
We pass that out at the state fair. Your dad helped us with. We got a ream of those, but I may need to print some more.
That's awesome. All right. Well, I'm not seeing any more questions, so probably everybody's had enough of the legislative stuff. Oh, I think I did want to say, I think it was it Hillary? Or no, it was Hildy. Okay, I'm sorry. I'm asking what's our argument for the penalty. I don't think it's anything more than it ever is. It's just the industry keeps saying that this is going to have this big, huge market impact, and so you've got to do something basically to dissuade people from switching. They want people, as you know, on Medicare Advantage. They don't want them to go on to traditional Medicare with a gap plan. So they were able to convince the legislature that, oh my God, we'll be, the gap plans are going to go up by 1,000% or something crazy. And you just have to make sure you do something that, keeps people from just going back and forth or whatever. And that's how they ended up convincing them that this was the way to do it. Yeah, Ken, go ahead.
So just one quick comment on the guaranteed issue, and I might be stating the obvious, but I think the moral of the story is people that are approaching Medicare enrollment age should not be bamboozled into signing up for Medicare Advantage in the first place. Then they won't have to go through this fiasco that just passed the legislature where they could be, any type of penalty up to 35%. So we as activists, I think that's our duty to inform people. Please don't get bamboozled into signing up for Medicare Advantage. And we just need to keep spreading the word. And if we know friends, family, neighbors, and we really care about them, advise them, don't sign up for Medicare Advantage in the first place. Thank you.
Yeah, thanks. I appreciate
I,
that.
I don't have, I don't know how to make a little hand up on the
Okay,
screen,
go ahead.
but just a comment on that is that nobody advertises straight Medicare.
Right, it's illegal.
And the providers Advantage programs spend millions of dollars advertising. Of course you're
Right.
going to lose. It just it does, the whole system doesn't make sense at all.
No, it's
And I
very,
don't think it'll work.
it's very tainted. I mean, traditional Medicare literally by law cannot advertise. So this
I
is
wonder why.
Yeah, well, and this is a major issue, and there are bills in Congress to make it also illegal for Medicare Advantage plans to do that kind of advertising as well. But the other thing is believe it or not, brokers get a lot more money to steer you into a Medicare Advantage plan than they do to put you into traditional Medicare with a Medigap plan. It's a pretty sizable difference in the broker commissions, and all of that money is Medicare premium dollars. I mean, that's where it's coming out of the Medicare fund. We're subsidizing that program in a big way, and those subsidies are going directly into shareholder dividends and stock buybacks and exorbitant CEO compensation packages, and it just has to stop.
Does legislators know any of that?
Well, we certainly have done our share of trying to, we've been working with just even with members of Congress to help them understand this because they're the ones who control obviously Medicare, right? But here in Minnesota, we're trying to figure out how do we do an education program on Medicare Advantage because it is literally you can just take the microcosm of Medicaid and extrapolate from what's happening in the privatization of Medicare, and you can see what's happening in Medicaid in the states. And so this is all part of our work in educating legislators so that they have a deeper understanding of this stuff. Yeah,
So
and go
we
ahead.
are at
Yeah.
7:20, so
Yep.
I'm going to say that all of this leads us right into our next topic, which is Dave Garibaldi, Don Pilkinen, co-chairs of our Healthcare for All Minnesota Legislative and Policy Committee, talking to us about building relationships and influence with our legislators, which also, of course, means our members of Congress. Go ahead, Dave and Don.
Well, I will start off, excuse me, for a persistent summer cold, but I will soldier on here. As lead up to the constituent to legislator communication project that Dave is going to cover, and this is to move forward during the interim with the patient-centered care bill. and the studies from Department of Human Services and Department of Health, I also crafted a narrative of the 2025 legislative session, which overlaps with Rose's very thorough presentation. But she and Ann agreed that repetition is good. So the story of the 2025 legislative session from our side is highlighted by 139 HCAM and PNHP Lobby Day registrants on March 10th from 42 Senate districts meeting with their legislators on patient-centered care and other stepping stone Minnesota health plan bills to make Minnesota's health care better. Now contrast that with the heavily compromised, regressive healthcare legislation coming out of the session, which is a far cry from the progressive legislation of the 2023 session that included Minnesota Care for undocumented immigrants. So the most outrageous and regressive healthcare law of 2025 is removing hardworking, undocumented adult immigrants from Minnesota Care, for which the savings in the budget is small, which makes the unspoken issue for their removal very, very disturbing, and which is why all DFLers in the House, except one, voted against it. And all that was said about the decisive vote for the bill in the Senate was, it was one of my most painful votes. Also regressive and harsh was the exclusion of the Medical Debt Reset Act from both the omnibus health bill and the special session, which would have forgiven medical debt for hundreds of thousands of fellow Minnesotans by the state appropriating only $5 million for a nonprofit to buy and forgive debt for about 500 million in medical debt, but for the debt of $500 million for 250,000 to 400,000 Minnesotans. Other hurtful legislation finally penalizes enrollees in Medicare Advantage plans who opt to switch back to traditional Medicare with a supplemental Medigap plan that was pretty well covered. Apart from the loss of these direct service programs for immediate health coverage and medical debt relief for hardworking Minnesotans, excuse me, were setbacks for our strategic deprivatization bills for setting up the Minnesota Health Plan by removing MCOs and PBMs. In other words, reforming healthcare finance. As Rose said, what would have been overdue deprivatization of the dental program in medical assistance and Minnesota Care with the carve out of MCO involvement to show that government-run healthcare is more cost efficient, legislation passed that extends MCO involvement for 2 more years. And also covered very well by Rose and Ms. Ocean, the pharmacy drug carve-out bill that would have terminated MCO participation in the medical assistance and Minnesota Care drug programs was superseded by legislation that still has a PBM that MCOs must use for pharmacy benefits in those programs for 2 more years. Even with these setbacks in our campaign to deprivatize medical assistance and Minnesota Care from the MCOs and PBMs, the direct payer patient-centered care bill, along with studies by the Department of Human Services for direct payments to medical assistance and Minnesota Care, and by the Department of Health on administrative costs in healthcare spending, remain as the rational linchpin for these programs to be state-run. However, this will require a political force of legislators to support and vote for the patient-centered care bill and to work with us to ensure that the Department of Human Services and Department of Health Studies on direct payment and administrative costs are evidence-based when they are reported to the legislature. Therefore, keeping in mind the people power shown on Lobby Day, March 10th, and to keep it going, our legislative subcommittee developed a constituent to legislator communication project for constituents to make the case for the Minnesota Health Plan by educating their legislators with historic evidence on the failure of the HMO contractors, of medical assistance, and Minnesota Care to contain wasteful spending of those programs since the contractors were inserted in the 1990s in those programs. So Dave will now explain the constituent to legislator communication project and how it's already getting started in some Senate districts.
Thank you, Don, and good evening to everyone. I've done this work now for quite a few years, 7 years, and done a lot of tabling. And one of the things that people ask me that seem to agree that this is a good idea to get a single payer plan is what can they do? And if they don't ask me that, I still end up telling them what they can do, because this is so important that we start talking to our legislators. It can't just be a handful of volunteers that are at HCAM. It's got to be the members, and it's got to be their family and their friends. We just need a whole lot of people to start clamoring for this so that they get it. Because they don't get it right now. They really don't. I mean, I talked to my legislators and I think I've got them pretty up to speed, but what happened last session is a great indicator that we need to get more information out there. So to win the support of legislators for the Minnesota Health Plan, we must not only inform them about the Minnesota Health Plan legislation itself, we must also inform them about interim legislation, which will advance the Minnesota Health Plan rather than delaying it by taking us backwards. As you've already learned from Rose and Don, the lack of strategic planning, collaboration, and awareness of potentially adverse consequences of legislation passed this session was, in our opinion, detrimental to our goal of enacting the Minnesota Health Plan. This session, legislators had the opportunity to do substantial deprivatization of medical assistance in Minnesota Care. Unfortunately, they ended up repealing strong legislation already passed or watering it down with weakening amendments. So how did this happen? Our opponents had lobbyists who leveraged some of their allies on the health committees to support the weaker bills. They had their targets and they went after them early on, and they basically got ahead of us, which was pretty easy to do. Our friend Buddy Robinson has told us that there's 30 some lobbyists that do this work in the Capitol on healthcare. So it's not hard to tell why they can pull this off. If they got people in there every day bending ears, they're going to have the edge. But that's where you folks come in. At this stage of the game, We can't afford to hire a 6-figure lobbyist to walk the halls of the Capitol for 3-4 months. And that's where the constituent to legislator communication project comes in. So we're talking about using 2 main methods to communicate with and inform legislators about the critical need to remove insurance companies from our public programs. And the first one is actually already started. In fact, the first letters to constituents were emailed to 135 Lobby Day registrants on June 2nd. It contained a cover letter explaining the project and the first of a series of informative letters drafted by Kip Sullivan and the Legislative Policy Committee. We will follow with letters educating legislators on the critical need for deprivatizing our public health programs, as well as what needs to happen to ensure accurate studies are done by the Department of Human Services, Health and Human Services, and Minnesota Department of Health by January. Those studies are extremely important. If these studies aren't done right, we could almost say goodbye to the Minnesota Health Plan. So we have got to make sure that the legislators are involved with taking up issues that we know are important to making sure those studies are accurate. So these are complex but very important issues that are critical for our legislators to understand. We are committed to providing our activists with the information they need to do these actions as simply as possible. So what this all boils down to is we send you a template of a letter, and you just fill in your legislator's title and their email address in the send portion of the email, and you sign it with your name. And then when you get an answer, hopefully you'll get a reply. Please just forward that to me, directly to me, and I'll tell you how to do that. So I'm moving on to our second one. Our second means of communicating with legislators will involve constituents and HCAM leaders directly meeting with as many legislators as possible before the 2026 session begins. We're meeting first with sympathetic legislators to talk about our patient-centered care. We also call that direct provider payment bill, which also means that we'll be talking about the MDH and DHS studies due in January. And we come back to the importance of those studies. So secondarily, we would like to explore their ideas on getting our DFL allies in the legislature to communicate much better with each other and with us. And as you know, HCAM is nonpartisan. I'm saying DFL allies because thus far we don't have any Republican allies on the Minnesota Health Plan or deprivatization. If we did, we would be jumping for joy. So we are presently organizing the initial meetings with SD 63, which is South Minneapolis, and SD 51, which is the Richfield, Bloomington area. And we may be doing another one in Mankato. We are currently creating a list of other SDs, Senate districts, and organizing units throughout the state. Before the next legislative session begins, we hope to have informed as many legislators as possible about the damage that privatization has inflicted on our healthcare system in Minnesota and how to fix it by enacting the patient-centered care bill, direct payment, and ultimately the Minnesota Health Plan. So you all can get involved in these activities. And I'm going to put my email in the chat, and it will be sent with the post-meeting information. I'll be glad to send you that first letter that we sent out if you haven't gotten it already. If you were one of the lobby day registrants, you might have already gotten a copy of it. But I would be glad to send that out, and it's very simple. It's got great instructions, and you can always email me back if you have any questions. So with that, I guess we can take questions or move on the agenda. Thank you.
We have about 5 minutes left for this item on the agenda. If anyone wants to ask anything of Dave or Don. Jeannie, unmute yourself.
Okay. All right. My question, and I've asked a number of different groups of people, and no one's really come up with a good answer for me, is I wanted to know, how did the hospitals feel about all of this and the changes that were made in all of the legislation, especially the payments that they get for reimbursement, and the immigrant people that are not going to have health insurance, but are going to show up in everybody's ERs to be treated for something that wasn't caught early on. So if anybody has an answer for that one, I would appreciate it.
You know, Jean, I'm pretty sure that when I was up, a group of us went up and we were supporting the immigrant healthcare rally that was held when that deal was struck, right?
Yeah.
And hoping we could peel that back. And I'm pretty sure I heard that day that actually the Hospital Association was in support of the immigrants being covered for all the reasons you just noted. So
Yeah.
I think MHA was actually on board with that particular piece of legislation. I don't think they're very happy that it got repealed.
Okay. Thank you.
Yeah, because you're right. They're the ones that are going to get harmed by it.
Yeah.
Dave has put his contact information in the chat. And this will not be the end of hearing about how you can help build the political will for change. So we're almost at the point where we will move into the next part. This is the audience participation part of the meeting, y'all. I invite you to turn your videos on. You should look on the bottom left side of your screen and turn your video on so we can see your faces. And then we would like to hear your ideas about what more we can do as an issues organization with the help of our supporters and advocates to build the political will for how we pay for healthcare in Minnesota and then eventually in the US. So Rose is going to start us off with a summary of work that we as an organization and with our partner organizations, especially Physicians for a National Health Program, what we feel we've done so far. And then facilitate what we're calling a brainstorming session where we get your help with your ideas about anything we're missing that you think we're missing. So go ahead, Rose.
Thanks, Ann. So I want to sort of set the stage a little bit in regards to this discussion, and then I'm going to open the floor up and we want to hear from you all. But as you all know, we have a campaign to win the Minnesota Health Plan. It is a 4 to 5 year strategic campaign. We're calling it, at the moment at least, the Pathways to Healthcare Justice campaign. And the steering committee of that campaign had their first meeting on June 5th. So we are officially up and running right now. So that is very, very good news. As you know, Healthcare for All Minnesota itself is already kind of structured like a campaign. We're structured in a way that makes it really easy, therefore, to transition some of the work that we're doing over into the campaign itself, right? Why duplicate efforts? Why do double the work? So the proposition that we made and what we proposed to the steering committee was that the structure of the campaign, at least for now, would look like the flow chart you see here on the screen. So the steering committee would have up to a maximum of 2 representatives per partner organization. And I will find my list of those partner organizations that have signed on in a minute, and I will tell you who they are. The hope is that we would be able to raise enough money over the next year to actually sometime in 2026 hire a campaign manager that would help us pull this whole thing together. Potentially, we hope to raise additional funds to maybe even be able to have a couple of field canvassers or organizers. And who knows, we even had some discussion about whether it would make sense to have at least a part-time lobbyist just to be able to react in the moment as things get, thrown against the wall up at the legislature. It might not be such a bad thing. You can see, that we have under organizing, we have Coalition Builders Committee, and we have a base building committee, and we have audience inclusivity, which is our committee that makes sure that we are doing outreach and being inclusive to communities of color, to younger people, to the LGBTQ plus community, and those most harmed by this system. And so those would be also incorporated into the campaign itself. We would, of course, have to have fundraising because every campaign, unfortunately, needs money. Legislative and policy would also, of course, be an aspect of the campaign. And then communication is going to be a critically important committee as we think about how to develop our messaging and etc. So the expectation would be that our organizational partners would help us fill out all of these committees and start to assign staff and or members to each of those committees of the campaign. Just to refresh everyone's memory, the purpose of the Legislative Policy Committee is really to monitor research and provide guidance to the steering committee regarding legislative priorities for the campaign. One of the projects that we think would be a good one to be thinking about doing is getting scheduled, starting again with kind of the usual suspects who are on record as supporting the Minnesota Health Plan, but schedule DFL County presentations on the plan, on the campaign plan itself, right? So that we can get the party to really buy into the campaign as well, and work to schedule health equity town halls all across the state, not just in, the blue or the purple areas, but all across the state, because we very much need a rural greater Minnesota healthcare campaign plan to get more of those folks engaged, because we all know they're really getting hit in those areas in regards to healthcare access. Fundraising is obvious, develop sustaining cash flow, and then also create the ideas for future fundraising events. Comms, as I said, it's all about determining our brand, developing all the content for what goes onto websites and toolkits for people to be able to use. And, what does the style guide of the campaign look like? And coming up with some creative messaging for the campaign. All of that needs to be sorted out. And so that's going to be a critically important committee. And we really want to get that one up and running as soon as possible. Coalition and base building will continue to be working on bringing more organizations into the campaign, as well as building our grassroots activist base. We think that it is important to develop a specific plan, as I said earlier, for engagement of greater Minnesota constituents, as well as the younger generation and people who are most impacted by the cruelty of this system, the way it is set up now. And then finally, of course, major important committee work done around education and training. So we're going to continue our terrific work that we've been doing on education and training, and focus it on the campaign on things like policy education, advocacy education, and organizing education, because it's all about educate, agitate, and organize. I'm a union organizer, as most of you know, by trade, and that's the way you get people engaged in a campaign. So with that in mind, at our first steering committee meeting last week, we did determine that for the remainder of 2025, we're going to be focusing on power mapping: who's in the room, who isn't, who should be, and who is the best messenger to get those folks into the room. And quite frankly, who is on the other side of this issue? Who are our enemies going to be? And let's make sure we have a game plan for how to counteract all that's going to get thrown at us from those on the other side of this issue, right? That's important work that we need to do. We also want to get ready to get the committees up and running in the next few months, design a 25-26 calendar, and then, of course, a budget as well. And then we're hoping to maybe sponsor a fall meet and greet with legislators. When I was with the Minnesota Nurses Association, they did this every year every time there was an election. They had a meet and greet for all of the newly elected state representatives to come to the Nurses Union Hall, have a little, hors d'oeuvre or whatever, and sit and meet the nurses. And then we had everybody sit down and did a presentation of what the nurses were going to be presenting for the next legislative session, why those were the issues and the bills that the nurses most wanted to work on, and explain how important it will be for the legislators to support that work, take their questions right there and then, hear their concerns about that legislation, and then figure out how you build relationship with them. I think that's a really good model that we should consider for our work going into 2026, with a real focus on deprivatizing Medicaid and Minnesota Care. So that is going to be a big part of the work of the campaign coming up here in the next few months. So the big, question really is, where do we go from here? We should be very proud of the work that we've done to date, but of course it's only the beginning, and we clearly need to start adding to our toolbox to figure out what are those next steps. Just as a refresher, here's some of the things that Healthcare for All Minnesota has been doing. We had regular post-session meetings with the Minnesota Health Plan Caucus leadership all last summer. When it comes to Minnesota Department of Health and Department of Human Services regarding all of these various studies, reports, and plans developments, we have been meeting with them regularly. We have been sending out communications and letters to them and copying the leadership in the House and the Senate, as well as the governor's office. With regards to this new Center for Healthcare Affordability, we have met the director of that center, and we had a meeting with her. A couple of us have actually now applied to be on the Healthcare Advisory Task Force that is going to be advising the Center of Healthcare Affordability. We really are trying to get them to focus in on the failures of managed care and the waste that is in managed care, and get them to be much more evidence-based in what they present to the legislature, so the legislature can make good decisions about how we move forward towards the Minnesota Health Plan. We have had direct input into the stepping stone pieces of legislation and this strategy that we have been laying out now for the past year. We've done, as I said earlier, multiple presentations to community organizations, labor unions, and political party entities. We've developed this campaign plan. That was something that Healthcare for All Minnesota put together. We sponsored a very well-attended lobby day. I think we created a lot of buzz, and I'm even going to give us credit for the fact that legislation on that dental carve-out ended up 2 years instead of 4, was because we're the ones who brought it to the Hill and said, you guys shouldn't do this at all, just let that thing alone. And then, of course, we are in attendance at all major events that we can be at. Coming up soon is Pride Festival. We have done Farm Fest in the past, and the Minnesota State Fair, of course. So that's a lot of really good work, and that you all have been involved in that as volunteers as well. It isn't just the leadership of the organization. And of course, our partners at PNHP have been critical in this work, but it just hasn't been enough because we, as I said earlier, and Dave said, and Don said, here we are, right, with a legislative session that seemed like it was all over the place. So with all of that in mind, I want to do some interactive work with you all tonight and ask you, what ideas do you have for engaging more directly, both with legislators, but even with the general public? How do we educate them on the plan to actually achieve the Minnesota Health Plan, as well as bring more organizations and voters into this campaign? I know there are lots of you out there who have been involved in campaigns, whether they be electoral or legislative or issue campaigns. So raise your hand, or if you'd rather, put your ideas in the chat so we can use the feedback that you provide us here tonight in developing our where do we go from here plan. So I'm going to keep this up, or no, I'm not going to be able to actually. I think I can leave this up, and as you say things, I'll put them right on the screen. I think you can see the.
Okay. So you don't want people to be on video then?
I'm sure they can be on video. Of course they can.
Oh,
But
because
I'm just saying.
I can't see anybody right now.
Well,
Gallery.
I have a question. You were going to mention who some of the
Oh, yeah.
allied people were or groups were, because that's critical.
Yeah, let me, I just got to get the right paperwork in front of me, so give me 1 second on that. I'm terribly sorry.
Okay.
I meant to have that in front of me. I think oh gosh, did I do away with it? All right, let me just pull it up on my computer for a second. Again, my apologies for not being better prepared. I usually am. But I'm
While Rose is
You're awfully
doing
good.
that, let me remind people that if you want to speak, there's a little heart down at the bottom of your screen. It's called React. You just hover over that, you click on raise hand, and your hand goes up.
All right,
Oh.
so our current partners that have voted to join the campaign to win the Minnesota Health Plan are Copal, the Minnesota AFL-CIO Retiree Council, the Minnesota and Dakota's Retirees United, Indivisible St. Croix Valley, Indivisible St. Peter, SEIU Local 284, of course, Healthcare for All Minnesota and PNHP, the Minnesota Association of Professional Employees, and the Minnesota Nurses Association. We also have the St. Paul Regional Labor Federation Retiree Council has joined us as well. And I believe that the Minnesota Federation of Teachers Local 59 retirees are now on board too. So we are still doing outreach, of course, and what we are hoping to do is bring in the Minneapolis Federation of Teachers and paraprofessional educators. We are hoping to eventually maybe convince Education Minnesota, SEIU Local 26, and Healthcare for All, and Healthcare Minnesota and Iowa. And we are going to do some outreach to the Land Stewardship Project and continue developing our relationships with, Isaiah and Unidos and the Minnesota Farmers Union. So still doing some outreach work.
What about the Land Stewardship Project?
Yeah, I said them.
I'm sorry.
They're not on board yet because they actually told me a year and a half or so ago that they just needed to take a breather on healthcare because they really were focusing on agriculture stuff and climate and things. But rumor has it that they've sort of put healthcare back on their list, and so I plan to reach out to their executive director soon and see if we could get them to join our campaign.
Great. Just one other comment on that is getting everybody to buy into the same package. That's what's really bothering me about the Democratic Party is that, they're running in 25 different directions. And to me, it seems like the ego of everybody is more important than the terrible situation that we face.
Yeah, I know.
And it's going to kill us.
Well, that's why I'm asking for ideas because we've tried a lot of things and we've made a little bit of headway, but not enough. So I don't know if anybody else wants to throw some stuff out there at me. Feel free to do that.
Well, I just have one other comment, and I think that given this last election, you should be very proud of what you've accomplished, because I'll tell you, the Republican Party went into that session with a bottom line that, like you saw, they're not going to give. And the worst thing that could have happened was that the state didn't fix the budget. And if they started lay off people, it was going to be back in our face.
Yeah.
Into my comments.
Well,
I
Um,
see hands up, Michelle Christian.
Yeah, hi. I just was wondering if Minnesota Nurse Practitioners Association is involved with this issue. Are they partners? And if not, they might be really good partners too.
yeah, we would love to, if you can help facilitate, Michelle, just like a get together with any leadership in that organization, because I completely agree that they would be a perfect partner in this. We just haven't had an opportunity to find a connection to build that relationship with them yet.
Oh, yeah, I can contact them.
Oh, that'd be awesome. And I mean, Anne is an RN, but nonetheless in the nursing profession. So we certainly, and while I take a few days off when I get this hip replaced in a week, we would certainly be more than happy to do a Zoom meeting or something like that, just to introduce ourselves, talk about what we're doing and get to know them and build relationship. And we'd love to have them as part of the campaign.
Sure.
Michelle, can I take your phone number down right now?
Yep. 612-860-2056.
Okay, thank you.
Awesome.
Sure.
Thank you, Michelle. And it's Michelle Christian, was there a Christensen?
Nope, just Christian.
Yeah. Okay, there you go. All right. You went off the screen for a second for me, so thank you for that.
Sure.
Thank you.
And John Crossan has a hand up.
Yeah, I think we need to have particularly the Education Committee concentrating on educating not only the legislators, but also the constituents in outstate Minnesota. This is where we really have to make an impact. And I think a lot of our efforts should be aimed towards outstate Minnesota.
Okay.
Why can't I spell practitioners?
Practitioners.
I'm missing a. Isn't that? Oh my
I got
God.
it.
Sorry. Good Lord.
Oh, no, one N.
It's one N. I'm sorry. It's not telling me. Oh, there. Now it just came up with the red squiggly line underneath. Because at first I'm like, what is it I'm missing here? I'm so sorry. All right. And so, yes, John, there's no question. That's why I said that one of the first. Well, one of the first things that we need to do is within the campaign itself is develop and create a plan specifically for Greater Minnesota and engaging those voters, not just those legislators. So that's already built into the plan. Judith, I think you've got a hand raised.
Yeah, I have three things I'd like to just throw out.
Sure.
One is the city council resolution work. I don't know if we're just going to throw that to the side or whether we're going to continue on with that, and because, well, I think it's important, but it's another thing to do anyway. Then the other thing is Mark sent out I loved it, an email with how to follow bills, and I wish we would be all educated in that. And I didn't see that in the plan anyplace. And I think I could find the email that he sent, but I just thought it was a very good way of us to learn how to follow bills. I mean, I could probably look it up, but it was just, it was right there for us, easy to do. And I think it's important for us to follow bills. And the other thing is the union work. You get great work on union, but I was talking to somebody in the auto industry, and he's third generation of union, but he's ready to look at universal health care because he knows what we're talking about. We're in a mess here, and we don't know what's going to happen in any industry. So he doesn't know about his great union health plan, so he's ready to look at universal health care, which I think is a big step for
that's
somebody
awesome.
in the auto.
Yeah, for sure. So on on how to track legislation. So if you remember the slide that I brought up that said there's going to be these three components to I'll go back to it here a second. These three components to education and training under both policy and advocacy education would include how do you track bills? How do you stay on top of that? And even, we've even talked about if we get a handful of members that are like available, first of all, to do this, and they're interested in this, maybe if let's say we have 4 bills that we're really watching closely, maybe everybody would take one bill and just kind of track it for us and then report to us regularly and keep us posted when we need to like do a call to action, right? To tell everybody what they need to do for it. But anyways, yes, we absolutely plan to do education on how to track bills and how to and then how to advocate for it and get people engaged in that process. Awesome. Thanks, Judith.
And Mary Lund has a hand up.
We know that people are unhappy with our current healthcare system, generally speaking, and so I think that's our big opportunity. That's the big thing we have working against the powers that be. But people have to know what they're aiming for. I have tried to talk even my sister into original Medicare, and I couldn't even do that because no one wants to let go of what they have until they know that it's something better at the other end. I think that, we need to get what is the plan out there? What is the goal? What is the shiny Christmas ornament, so to speak, that we need to work for? Until they see that, it's going to be difficult to get enough momentum going.
Yeah, I think that's a really good point, Mary. And well, both of your points, both of the fact that the current sentiment about the industry, overall, I mean, we saw that right after the murder of Brian Thompson, the CEO of United Health, that it surprised me that what was the sentiment coming from the public after that horrible thing happened, because nobody supports murder. That was not okay. But at the end of the day, everybody was like, well, wait a minute, insurance companies are killing us every day, right? And that was how they felt about it. They were just furious with insurance companies and the way that they operate. And that was more of what they wanted to talk about than someone being struck down that way. So I think that's right. And tying it to what exactly the goal and the plan is, you're right. There is something called fear aversion, right? I mean, it's loss aversion, actually.
Loss aversion.
Yeah, right. Fear of losing something that you already have, and what's going to come is only going to be worse. We've got it, and that's part of the developing of the message that we have to do, and that ties into the education. But also remember, we're going to actually get some numbers finally with the cost analysis that's going to come to the legislature in 2026 on comparing a universal Minnesota health plan system to the current system. And once we get those numbers, then we can work next summer to actually put hardcore financing inside the bill. And we hope to work with on a national level. There's a couple of people that have done this across the nation, and they've said they will help us with this. They would create a calculator. So you as an individual could go onto that calculator and say, here are my numbers, my income, my this, my that, how much out of pocket, blah, blah, blah. And that's what I'm paying in the current system. If we had the Minnesota Health Plan, here's what you would pay based on that information, right? And people will be able to, in a concrete way, see, most everybody is going to save money, and B, underneath that will be listed, here's all the stuff you're going to get for that amount of money. No deductibles, no copays, right? No networks. You're going to be able to go to the doctor that you want to go to, and whether it's a mental health issue, whether it is, help with substance, addictions, whether it is maternity, whatever it is, guess what? It's going to be considered healthcare, dental, vision, all of that, and it's all going to be covered for that lesser price that you just saw when you did that calculator. So I think that's going to be really helpful in starting to really get more people engaged. But it's a valid point. Thank you for that.
So I have my hand up because I see in the chat, trying to follow the chat, it's hard. Louise Sundin says, add Minneapolis Regional Retiree Council who voted in.
Yeah, I thought so, Louise. So I said, or the regional council, right? And the MFT retirees are also in, right, Louise? Or no, not yet. Couldn't remember.
Yes,
Okay,
yes,
I will,
Okay.
and we need Anne or Rose that the list or the organizational chart. So now we're asking members where they would, who would like to represent us and what committees
Yes.
they might want to be
Thank-
on. So just that one slide would be helpful. Thank you.
sure,
Thank
no
you
problem,
so
Louise, I'll
much.
send it.
And Louise, make sure that we have you're the contact for that.
Yes,
Is that correct? Okay.
yes.
Okay.
Awesome.
And then, let's see, Liz Ward. Oh, I'm sorry. There was one more thing in the chat. I'm sorry. I see something about we need to debunk the biases against systems in other countries.
Mm.
See, Teresa, we need, and we've worked hard on that. We have a really good volunteer who's worked in both systems, who helps us with some language around that. But yes, we need to do more on that. Liz, you want to go ahead?
Sure. A couple other things having to do with communications, and mostly to just clear up some of the things we're talking about right now. You know, little short snippets, taglines, maybe even under the current logo. There's also confusion, at least on my part, between Healthcare for All Minnesota and then the Minnesota Health Plan. How do we think about these from a communications standpoint? And perhaps there's somebody that knows somebody who's a graphic designer. I come from more of an art direction copywriting background, so I wish I were a designer. I'm not. But some things that can do, looking at other campaigns like the marriage,
Mm-hmm.
the marriage
Equality campaign, yeah, yeah.
and the love is love is something pithy and sensible that people can grasp, because we try to say too much. It's a huge topic. We have to distill it to something like that. So that's a comms issue. And and I just also wanted to add differently, let's see, someone said small businesses. So the SBA or what some of those other small business association or some of those other get-togethers or roundtables.
Yeah, to that, Liz, we have a good contact with the Main Street Alliance. They have waxed and waned as far as their membership goes, but I think they're coming back. And we've been working right from the beginning with people in the Main Street Alliance. I think SBA is a government thing, so we won't get help from them. There used to be another small business group that I think has gone by the wayside, but yes, we are definitely in touch with Main Street, with small business owners via the Main Street Alliance. They haven't signed on officially though.
Yeah, they're the other ones who are really being hit. So that's all I had to say. Thanks.
Yeah, no, thank you. That's awesome. I just typed in here that one idea that I had was, once we get the financing figured out next year, I'm going to suggest to Senator Marty, as part of the campaign, that we bring together some roundtables, some stakeholder roundtables. And the most obvious ones to me are, like, there could be a labor one, because we've got to get labor on board in order to pass this. You're never going to pass this without labor fully engaged and willing to support it. And that doesn't mean we're going to get every single labor union to say yes to it, but I mean, you know, as a whole, we have to have at least a majority of labor on board with it. But we need to have everybody, even if they don't support it, in the room at a table telling us what they like, what they don't like, what would, you know, is there anything we could do to make them like it by changing anything that still stays within our parameters for, you know, a functional, you know, guaranteed health healthcare system. But we need to hear those voices also, as you said, from business, from the healthcare provider community, and then community organizations themselves. And I think it would be really good to try and see if we couldn't do some of those stakeholder tables.
Anything else, Liz, with your hand is still up? Hildy, thank you. The Metro IBA was the name I was trying to come up with. So somebody put in indivisible groups. We have a volunteer, a really good volunteer who is going to work on helping us reach out to, we have a bunch of indivisible groups who are real active on this issue, but there's like 74 groups listed statewide, and we're going to get a project going to connect with all of them in some fashion, either in person or via virtually, to give talks and get some engagement. Not every group has healthcare as one of their top issues, but the ones who do, we're going to try to snag them and get them involved.
And I wanted to just revisit what Judith said about those support resolutions.
Yeah.
I just met with somebody from New York yesterday who works for, I think it's a teachers union out in New York, and they're moving their own single payer bill out there. But it reminded me of the work when I was in California for 11 years that we did. I represented public school employees, not certificated, but the classified school employees, and we've got the largest classified school employee union in Minnesota in this campaign, SEIU Local 284. And one of the things we did was when we were in California is we created a spreadsheet, and it's pretty simple because this is public dollars when you're paid by a school district, right? And when they're buying your health insurance, it's all public data that we can get. And we were able to take, it's pretty simple. What's all the cost of the salaries that you're paying for everybody? Management, doesn't matter. Classified, certificated, everybody. That's one number, right? And then you take and you say, how much money are you spending to buy health care for everybody, including any retiree health benefits, that the school district is helping to pay for? You add that number up. And then once we have the number, and let's say, and I'm just throwing this out there, do not quote me because I have no idea what the number is going to be, but let's say suddenly we've found out that it's going to be 8% of payroll for employers. That's what they're going to pay on their payroll, 8%, and all their workers are going to get health care. And then the individual employees are going to pay 3%, right? So what we were able to do is take that 8% and multiply it by the payroll. And we said, oh, this is what you would pay if we pass the single payer bill. Here's what you're paying now. Here's what you could be paying. And when the school districts were like, oh my God, that's a lot of money we could be saving if we weren't having to, deal with this private insurance model. And we were able to then take all those resolutions that we got passed by school boards and push the local legislators who had those school districts in their district, their legislative district, and say, look at all the money your schools could save, and your school districts want you to support that bill, right? I mean, we were able to use it in that way, and you can do it with the city council, same thing, county, all of those entities. We were even able to actually push or get the director of, I don't know, what is it, businesses and finance or whatever, from Los Angeles Unified, which is the 900-pound gorilla in California, to testify at the hearing saying this bill needs to pass because this will save a lot of money for our public schools. And that's money that can go back into the classroom directly, right? So I think that it is worthwhile for us to think again about revisiting some of the type of resolutions that we might want to pass and support. It'll be easier if we get the funding figured out, I think. Anything else? Because we're right at the time for this, Anne, and I want to allow you enough time for your announcements.
Yes, thanks.
So thank you, everybody, for a sort of, allowing me an opportunity to just brainstorm together with you. Love it. Lots of good ideas here and more to come, but I feel really good about this. And quite frankly, from everything, and we're in touch with groups that are trying to do this in campaigns all across the country. And I'm telling you, I think we're really the only state that actually has a written campaign plan to try and make this thing happen. So we should be very proud of our work to date. Thanks, everyone.
Thanks so much. couple more things in the chat, but we'll save the chat. And I've got some announcements and base building and resources to share going forward. This is what it looks like when we storm the Capitol. So we're looking forward to that in the future. We have to get our numbers up and then get us to the point where we can fill that rotunda and fill those meeting rooms at the legislature. So to that end, there's a lot going on. Saturday, June 14th at noon, 11 o'clock, they start assembling for that rally. I'm sure all of you have heard about the No Kings rally coming up on Saturday. And they offered tables. So I went ahead and said yes, because a lot of fired up people show up at this stuff. So we will also be available. You can send people our way if you want. The march, I think, starts at noon, and then there'll be speakers from 1 to 3, and then we'll just be there and available. Monday, June 16th, at 8 p.m. Central, I believe. I've got a registration link that we'll share when we send out the slides. Whole Washington, another single payer state organization, is sponsoring the video or the documentary, The Power to Heal, which is about the fact that the Medicare and Medicaid Act of 1965 also actually desegregated hospitals and our healthcare system in this country. It's kind of a shocking story to those of us who never experienced actual physical separation of people by color in our facilities and our health systems, but this is an amazing story. We showed it about 4 years ago, and of course, Juneteenth is coming up on the 19th. So that's a kind of planned for that ahead of Juneteenth on the 19th. Wednesday, June 18th, a webinar on Medicare Advantage and what unions need to know. Rose is involved in that with the National Labor Campaign for Single Payer. I put the link for signing up for that event. That should be really informative. I think 7 p.m. Central, but if you register, you'll get the information. Thursday, June 19th, both groups in Mankato, Healthcare for All Minnesota groups in Mankato and Duluth are tabling in recognition of Juneteenth on the actual day. The One Pair States National Conference is coming up August 1st and 2nd in Denver, Colorado. There's an in-person and a virtual option. If you want to go to Denver, that's an opportunity. There will be a virtual option. It is an outstanding agenda and speakers, so watch for more information on that. You'll hear from Healthcare for All Minnesota with a few more details on that event. June 28th and 29th is the Twin Cities Pride Festival. Healthcare for All Minnesota and PNHP Minnesota will have a booth. Again, I think this is our 5th year. Please contact me at the phone number or that email address to volunteer. When you contact me, include your phone number so I can follow up with you. We're asking for 4-hour shifts, 10 a.m. to 2 p.m., 2 p.m. to 6 p.m., either Saturday or Sunday. We will provide training and via video conference, and that will be, you can attend either Tuesday or Thursday, June 24th or June 26th. And then, as always, let us know of events that we should promote to help either with turnout for the event or tables so that we can be organizing and building our base of support for this work. And then also send speaker requests our way, because we have several people who are very willing and able to get out and give talks. This is the logo for The Power to Heal. It is a very powerful documentary. And in the modern era, government is how we take care of each other. I always say government needs a little good PR. So we, the people, are going to have to show up until we reverse the actions already being taken by the current regime and put power in the hands of leaders who believe in freedom, democracy, and prosperity for all. We also need your help to spread our message in other ways. And one of the ways is our social media sites. Please consider setting up accounts if you don't have one, or going in often and amplifying the posts that you will find on Facebook, under Healthcare for All Minnesota, on Instagram, and on YouTube. We have a YouTube channel. It's called Healthcare for All Minnesota. If you look under videos, you will see lots of information on previously recorded events. And if you're not don't feel that comfortable talking about this issue, you will probably find a video or a presentation in there that you could share with somebody, anybody you talk to. We need a lot more followers on our social media site to increase traffic on these sites. Whether you like social media or not, it is kind of a good way to get our message out there, and it's essentially free. Except for we do have a social media specialist who we support financially, and there's a lot of good stuff on there. So also please read and share our monthly newsletter. Check out Healthcare for All Minnesota and PNHP Minnesota websites. Updates are ongoing. Look for articles and information that we can post on our websites, on social media, and in our newsletter. Check for legislative updates. And then I've got our websites will be in the notes. Also, Healthcare for All Minnesota is now on Blue Sky. We have left Twitter in the dust, and we if you are not on Blue Sky, you can set up an account by going to bluesky.com, and our address is up there. Please go in and follow. We just got up on Blue Sky, so please go in and follow, then like the posts and share. These are very useful websites. I've repeated them a number of times, and so we'll just send them out with the slides, but lots of incredible information. And these are organizations that have been doing this work for a long time. I know Rose talks to Alex Lawson at Social Security Works all the time. He is an awesome supporter and advocate for Medicare. Public Citizen has been in this work for a long time. Wendell Potter, newly reactivated as Progressive Democrats of America, have relaunched their Healthcare as a Human Rights organizing team. The first meeting was this past Tuesday. Any of these, you can go to the website and get signed up to get notices. I will make a pitch for getting involved, more people involved with one payer states. That's our national coalition of organizations who are working on single payer systems in their own states. And they are the sponsors of the conference coming up on August 1st and 2nd. That's my contact information. And let me then turn this over to Bahia after I wish you a good summer. If you possibly can. Hello, summer. It is coming despite the rain and chilly weather today. And I hope that we can all enjoy some of the summer as we continue to do this work, this good work. Bahia, please go ahead and talk a little bit about raising the money we need to do the work.
Absolutely, and thank you, Anne and Rose, and to all our other speakers this evening. I know it's getting a bit late, but please hang with me for just a couple more minutes before we officially end the call. A huge thank you to everybody who was able to join us tonight to learn more about the 2025 legislative session, where we've been and where we're hoping to go as we plan to hopefully pass the Minnesota Health Plan. Not hopefully, we will. It's just going to take a little bit of time for us to get there. And we just really appreciate you being change makers with us. We can't do this work without money. And so fundraising has been a central tenet of the work under HCAM. I've been dropping the donation link throughout the chat during this meeting, and I'll go ahead and share it again. But I want to mention something that's very exciting that was recently launched. We recently decided to implement an internal program to increase our monthly sustaining donors. This is through strategic phone banking, targeting HCAM members who have donated, HCAM members who haven't donated, and encouraging them to give as little or as much as they're able to. So it can be as little as $5 a month and as much as you're willing and able to give to help us do all of this really important work and fight for healthcare equity. We rely heavily on donations to get this work done, and so every little bit counts. If you're able to donate, even a one-time donation, that's always welcome. If you're able to become a monthly sustaining donor, we certainly welcome that too. No pressure, but I just wanted to make sure that we emphasize that fundraising is a really big part of the work that we're doing because it helps to keep us going. I also want to mention that we are planning for a gala at some point in the fall, most likely September. We're still nailing down logistics, but we'll email that information out once we have those logistics finalized. So be on the lookout. Be sure to keep checking your inboxes so you can stay engaged and learn about all the wonderful events and work that we're doing. With that being said, thank you so much for joining us this evening. We hope you have a great rest of your Thursday evening, a great weekend ahead. And to echo what Anne said, we hope you can get out and enjoy the warmer weather this beautiful summer. So thank you. Have a great night. Have a great weekend. And we'll be sharing out the slides and the recording really soon. Bye, everybody.
Could Rose, Dave, Don, and Bahia, could you stay on for just a couple minutes?
Yeah.